Parts of our healthcare delivery system do need fixing. Workers feel locked to their jobs because they get their health insurance from their job. And no one knows what anything costs. Even doctors don't know. As a result, everything costs more. Obamacare doesn't even address those problems. But it's supposed to solve all kinds of other problems.
You have turned, Mr. President, the right of every American to have access to decent health care into reality for the first time in American history.
Yippee. And Obamacare does promise to cover the uninsured and somehow to lower costs. And maybe it will. It's early yet. But I'm skeptical, and Obamacare is already creating some new problems. Let's talk to a doctor about that. Orthopedic surgeon John Barrasso. I should also say he's a U.S. Senator. So, John, what's that giant stack of paper next to you?
This is the red tape tower, John. It's over 7 feet tall, and these are just the regulations that have come out so far because of the Obama health care law. There's over 20,000 pages. You and I thought that the health care law, which was over 2,000 pages, was too long. But remember, so many times it said the Secretary of Health and Human Services will write the rules and regulations. This is just the first part of them that doctors and nurses and hospitals and patients and insurance companies all have to comply with under the president's health care law.
So that's the first part, more to come. But what about the goal? The uninsured, 40 million, 50, 20, whatever it is. It's a noble goal. Get them insurance.
Well, the president actually continued to use the word coverage instead of using the word care in the debate. Because just because you have a Medicaid card, which is the way the president seems to want to solve this, doesn't mean you can actually get care. What people wanted in health care reform was the care that they need from a doctor they choose at lower costs. But the president has failed in terms of trying to bring the cost down. Remember, he said by the end of his first term, families would see their insurance premiums drop by about $2,500 per family per year. No one has seen that. And in fact, if you go to a town hall meeting and you ask people how many of them think that they're paying more for health care under the president's health care law, all the hands go up. And then you ask them, do you think that the quality and availability of your care will be better? Nobody thinks that. Even Kathleen Sebelius finally admitted, she's the Secretary of Health and Human Services, that under the health care law there would be winners as well as losers. Well, many more people now believe they're going to be losers under the president's health care law.
And the costs are already going up. Associated Press reports claims costs are up 32%. I never quite understood how you could cover more people and have it cost less.
And the president has actually compounded the problem under the government mandates that you have to buy government-approved insurance, which isn't necessarily the insurance that you think works for you and your family in terms of what you want or need or can afford. You have to buy a very expensive level of coverage because it has to cover so many things, many of the things that aren't necessarily that are right for you or your family.
I see on the list every policy now must cover preventative care, mammograms, colonoscopy without any deductible, breastfeeding support, supplies, and counseling. So everybody has to pay for that even if you don't want it.
Everyone has to pay for government-mandated insurance, which has a whole long list of things that they have to cover. And, of course, the rates are going to go up if you have to buy a lot of things that you don't want.
All right, but what would you do about the poor? Without government, won't the poor suffer?
We need to make sure. I wanted to focus on getting actually the rates of insurance down so people could get the care they need from a doctor they choose at lower costs. But I don't think it helps anyone when the cost of care and the cost of insurance continues to go up under the president's health care law.
The other problem is that you're exempt if you run a business and you have fewer than 50 employees. So I hear businesses are saying, I'm not going to expand. I got 49 workers. That's it.
Well, the Federal Reserve is actually in its beige book last month said that one of the big drags on the economy in this country, the reason that people aren't expanding or businesses aren't expanding, people aren't being hired, is because of the uncertainty as well as the mandates in the health care law. Part of it is the number of 50 employees or fewer, so they're not hiring more people into those businesses. The other is in terms of full-time or part-time employees. We see now that one of the largest movie theater chains in the country has now said for all of their folks that are paid by the hour, they're going to be part-time workers only, which is anything less than 30 hours, because businesses aren't mandated to cover part-time workers, but they are mandated to cover the full-time workers. So you see in businesses, and we've talked to some, where they say, gee, we have an opening. Instead of hiring one full-time person, we're going to hire 2 part-time workers instead of, because of the health care law. The health care law is dragging down our economy, making it harder to people to find full-time work.
Does your doctor spend his time treating people like you or filling out forms? Today's doctors complain they spend much too much of their time just doing paperwork, not healing people, just handling insurance. And that's a terrible waste. And it's about to get much worse, says Congressman Ted Poe. So, Congressman, what do you mean?
What's going to occur now? The federal government has imposed new regulations, which means new codes for doctors to fill out when a patient comes to see them. Right now, there are about 13,000 codes that they have to check. That's the book you have there.
13,000 codes here.
To define exactly what happened to the patient and why they're there. The federal government.
So they can be reimbursed.
So they'll be reimbursed by Medicare and Medicaid.
And why so many?
Well, the federal government thinks there needs to be more, because there's going to be now 140,000 of these codes for doctors to fill out, and they're very specific.
140,000.
Going from 13,000 to 140,000.
It's already horrible, tiny, fine print here.
And none of these codes help make a patient better or healthier. They're very expensive. Average, let's say a sole practitioner doctor, will cost the doctor $80,000 to implement the new federal code procedure. If you have a bigger practice, let's say there's 5 to 10 doctors, it's about $250,000 for the doctor to implement the federal government codes so that when patient comes in, the doctor can't check bitten by a dog anymore. You have to check bitten by a Dalmatian, a Doberman, a Pit Bull, a Chihuahua. You have to be very specific. If you mess up, if you make a mistake, or you do it on purpose, then you're in violation of federal law. You won't get reimbursed. You could be fined. So that's what the doctors have to look forward to.
And already under the existing codes, you have a code for if you're bitten by a duck. A slightly different code means you've been struck by a duck. Who cares?
Who cares? The duck doesn't care, and neither should the patient or the doctor. You want to treat the injury. That's the biggest concern.
Injured in a chicken coop is a code for that. Fall at an art gallery. And we asked Health and Human Services why so many, and they didn't get back to us.
Not surprising.
But from what I read, they say this will help them plan for the future. And you ship information to another doctor, he knows if you walked into a pole or if you're a repeat pole walker into, and that might make a difference in how he treats you.
Maybe, maybe not. Does the federal government need to put all this detail in to just keep records at this great expense? And I don't believe they do.
It is unbelievable. This is the old book again, and the new one will be 5 or almost 10 times as big. That they're not just stupid. They must have a reason for doing it. They don't want to just build empires, do they?
Well, they are regulators. And we have to understand that when regulators go to work every day, and they meet around, and I think these big oak tables and drink their lattes, they decide, who shall we regulate today? Why don't we regulate the medical industry a little more and make doctors and hospitals fill out these very specific codes that don't treat a patient, but give us information about the patient? And that's what they do. Regulators regulate. That's what the law allows them to do.
Doctors are just meekly following these rules, right?
Yes, they are.
Doctors obey. You have to obey if you want to get paid.
if you want to get reimbursed or get paid or not be in violation of federal law, rather than expanding a practice and hiring a nurse or an associate or someone else on the medical staff, you hire someone to keep statistics for you so you can turn those into the federal government. And the federal government even shows online where you can take courses to know how to implement the new codes.
And give us some other examples. 9 different codes for being injured by a turkey?
That is correct. Whether you run into a turkey or the turkey runs into you, you're pecked by a turkey, or you're bitten by a turkey, there's a difference between being pecked and being bitten. So they have 9 codes for turkeys. They have about 5 codes for basketball. You hit by a basketball? Are you a second offender or third offender being hit by a basketball? Or do you have I don't know what the medical term is, a condition where you're always being hit by a basketball? So doctors have to figure this out and check that right. Put the number in, the 10-digit number, and check that number to make sure that they have.
Yeah, the codes are even long. W6161XA. They don't memorize this stuff.
No, they have a code book. They're going to get one a lot bigger than that one. So they have to look it up in the code book. Under what? I don't know. Do you look under turkey, or do you look under what you run into, or basketball?
What would you have them do? You're king of all Congress.
I think what the regulators and regulations need to make some sense. So what is the purpose? What is the goal? Of course, doctors need to be accurate in their diagnosis. But do they need to go through this much detail to get information to the federal government? I don't think they do.